Hello, good evening, everyone, and welcome Avish for the Teens Talk presentation. And I'm very excited about your topic today. And why don't you introduce yourself first? Tell me your name and what grade you are in, and why are you interested in this topic?
So my name is Avish. I am a 10th grader from Westboro High School. Um, I really love my community and I want to share my thoughts regarding cancer with all of you as I'm somebody who really cares about health and sort of the environment in general. So that got me thinking, is cancer really just genetic or could we be contributing to it anyhow?
Oh, that is wonderful. Yes, I'm curious to learn more. Uh, okay, so we can start the presentation. Go ahead and share your screen. Okay.
So
Press the slideshow. Yeah. Perfect. Yes.
So, first of all, what is the environment for us? So, the environment is not just, trees or water. It includes the food we eat, the air we breathe, the water we drink, as well as all the commercial and biological activities around us. It's essentially a complete ecosystem that shapes our daily lives. And why is cancer becoming uncontrolled? So control starts with us as the prevention. Mm, In our current world, cancer is spreading rapidly. So in order to control cancer, we must first control ourselves. If we fail to do that, it becomes uncontrolled. How is it rising worldwide? Well, in 2022, it's estimated that around 20 million new cancer cases were diagnosed worldwide. Nearly 9.7 million people died from cancer that same year. Future projections show that by 2050, new cancer cases are expected to reach about 35 million, which is about 77% higher compared to 2022. It's important to note that outcomes depend heavily on early detection and type. Studies show that global cancer cases have more than doubled since the 1990s, with cancer deaths also rising significantly as the world's population grows and ages. While survival rates have improved, many cancers still have survival rates below 50%, especially when they're diagnosed late. As cancer can be difficult to control once it develops, prevention through healthier environments becomes even more important. The prevention and environmental control are critical, and it is both a personal and collective responsibility. Genetics versus discipline. We cannot control our inherited genes or any random mutations. What we can control includes smoking and alcohol use, diet choices, physical activity, sun protection, and general environmental awareness. Many people believe that cancer is mostly inherited, but this is far from true. According to the World Health Organization, 4 in 10 cancers worldwide are preventable.
Hmm.
A sedentary lifestyle and its cancer risks. So, what is a sedentary lifestyle and how does it increase the risk of cancer? It includes sitting for long periods, low physical activity, and excessive screen time. It can lead to obesity, hormonal imbalance, and even chronic inflammation. What can we do to stop it or to stop the risks of a sedentary lifestyle? Aim for at least 60 minutes, aka 1 hour of physical activity daily. take short movement breaks during long study or work sessions, walk or bike when possible, and limit recreational screen time. Diet and processed foods. According to the World Health Organization's findings, eating just 50 grams of processed meat per day increases the chances of colorectal cancer by 18%. In terms of individual actions, you should choose whole, minimally processed foods, increase your fiber intake through vegetables, fruits, and whole grains, reduce processed meats, and limit sugar, especially sugary drinks. In terms of community initiatives, we should be clear food labeling, limit harmful additives, support local agriculture, and reduce marketing of unhealthy foods. What causes air pollution, which is another major cause of cancer? So it includes fine particulate matter, vehicle exhaust, industrial emissions, wildfire smoke. Even non-smokers can develop lung cancer due to long-term pollution exposure. 99% of the world's population breathes air that exceeds the World Health Organization's air quality guidelines. How can we control air pollution? As an individual, you should use public transportation or carpool, walk or bike when possible, avoid burning trash, and conserve electricity. In terms of community and government actions, it should be there should be investment in clean energy, stricter vehicle emission standards, promotion of electric vehicles, improvement of public transportation systems, and further control of industrial emissions. The impacts of smoking and tobacco. Key statistics include that tobacco use causes about 30% of all cancer deaths globally. Smoking in general is responsible for about 85 to 90% of lung cancer cases, and tobacco use kills around 8 million people globally. Even secondhand smoking can severely increase the risks. Why tobacco causes cancer? So, tobacco smoke contains 70 plus known carcinogens. These chemicals can damage DNA, cause mutations, and lead to uncontrolled growth in cells. How can we reduce the impact? As an individual, you should not start smoking, or if you have already began smoking, quit or at least reduce your frequency. Avoid secondhand smoking, as well as vaping and using nicotine products. At the community and government level, there should be education in schools regarding the topic of smoking, anti-smoking campaigns, smoke-free public areas, higher taxes on tobacco, advertising restrictions, and several support programs for quitting. Alcohol and cancer risks. Alcohol contributes to about 4% of cancer cases globally. Even small amounts of it can significantly increase the risks of cancer. There is never any completely safe level of alcohol when it comes to its risk of forming cancer. Alcohol is responsible for hundreds of thousands of cancer deaths worldwide each year. And why does it increase cancer risk? So when alcohol is broken down in the body, it forms a toxic chemical called acetaldehyde. This chemical can damage DNA, prevent cells from repairing damaged property from properly, excuse me, and can also increase the chances of mutations. Strategies to reduce alcohol impact include um, avoid underage drinking, limit alcohol consumption in general, and also choose alcohol-free alternatives when possible. At the community and government level, there should be education regarding alcohol and its risks, a reduction in peer pressure culture, promoting healthy social habits, strict age restrictions, limiting alcohol advertising, and public awareness campaigns. Our final thoughts include cancer is not only written in our genes, nearly 40% of cancer cases are preventable, and the environment and lifestyle heavily shape our risks. Prevention begins with awareness and self control. If you want a healthier future, you need to make healthier choices. It starts with all of us.
Wow, that's wonderful. Thank you so much for bringing this presentation, this information. And I think it's very eye-opening and extremely useful, especially for teens, right? Because the youth, they are the ones who are going to grow up into adults, and they make policies, they make rules, right? So there's a lot that we can do collectively, like you have mentioned in your slide, to prevent our environment and to have a healthy environment in our world to save all of us from cancer.
Yep.
That's wonderful. So specifically, I wanted to ask you, did you do any research on about childhood cancer? Like there are a lot of young children who gets cancer as well. So that could be genetic, or do you think it could be also be environmental factors there? Have you looked up into it?
Environmental factors, well, I didn't research much about like how certain age groups
Hmm.
are more or less vulnerable. I researched more about how specific choices or yeah, like specific choices that affect our environment could potentially increase the chances of cancer or the risks of developing it.
Okay, all right. So I
Uh,
thought in one of the slides, you mentioned that physical activity is very important as well, especially for teens, about 60 minutes of physical activity, which is one of our mission here in Yogami Kids is also about promoting healthy habits, especially in young children, start the healthy habits early so that they can carry on in their adult life as well. My
yeah.
question is, what kind of physical activities do you do personally?
Personally, well, I like in terms of physical activity, I do some general sort of stretches. Like, right now, of course, it's the winter, and
Yep.
that's why we can't do much outdoors. So, a lot of my physical activity is indoors, such as, walking on my
Mhm.
treadmill, say, or um, using my rower. Those are just some of the few examples. There is a YMCA in my town, so
Mhm.
a few times I go there to practice swimming or to work out there as well if I feel like it. In When the weather is better, I often do a lot of biking as well.
Wonderful.
Mhm.
Good, good. Yes. It's very important to keep ourselves physically active for
Yeah.
sure. And yes, like you mentioned, sedentary lifestyle, too much exposure to screen time, all of this contributes towards, a
Mhm.
much unhealthier lifestyle. What
Yes.
do you think about the impacts of or influence of stress on cancer? Did you have any information or data about that? How stress impacts your body?
Um, I didn't specifically research much about stress, but what I can say is that stress definitely um, is more harmful for your body than beneficial, because it's often one of the like main it's one of the main causes of people, not being physically active enough or not making very sort of healthy choices with their diet or say like there's with like the general well-being. So
Mhm.
um stress, again, I didn't research about it specifically that much, but it definitely has um like some negative effects
Yeah.
on
Stress
people.
in general is not beneficial because if you're not managing your stress well, probably you might end up eating a lot of junk food, or you might get the alcohol or smoking, all these
Yes,
unhealthy habits creep in
yes.
just to manage stress, and that, of course, leads to other problems.
Yes,
So,
mm, people can have stress for many different reasons, of course, but it's
yes.
always important to sort of manage it or to, not let it
Mhm.
um take over you in a way in
Mhm.
which it would like prevent you from doing other like important things or like it prevents you from taking care of yourself.
Absolutely. So, are you conscious about your screen usage?
Screen usage is, again, I do have some screen issues, of course.
Mm-hmm.
I try to like maybe a few times I might like say if I've been on the screen for really long and
Mm-hmm.
and like say when I realize about my screen time or when I start to, realize that maybe my eyes don't feel good or that I'm starting to like say like I don't feel very comfortable, then I might take some breaks in between, or I might like try to do something that does not involve a
Mm-hmm.
screen. So
Mm-hmm.
um again, like much of my the thing is like much of like the stuff that I enjoy doing, if I'm being honest, pretty much everything that I enjoy doing is
It's
on
on
the
screen.
screen, like
Yes,
apart from any like physical
that's true.
things. So it's not easy, but I still try to like take breaks or to do like whatever I can.
Yeah. At least if you're aware of how much time you have spent, you can consciously take that break, give yourself a little shake, move around, move your body, do something else for a while, and then you can come back to it,
Yeah.
right? That's wonderful. So, how did you start getting interested about health? You can stop sharing your screen now, uh, but I just want to know how you got interested about health, and
Mm,
I can do
sharing.
it. Yeah, go ahead.
So I got interested in health because, like at my school, there's of course like a lot of talk about like how like my generation or sort of, like several people that are maybe like growing up the way I did are,
Mm-hmm.
um, like, doing like or like are experiencing many things that could be harmful and are like bad for them or sort of not good for them. And
Mm-hmm.
um I also began to learn about like how like different like environments like how like some of today's materials or like today's um like like some of the stuff
Research.
that today, how it can affect the environment, and
Mm-hmm.
all that basically got me like really curious
Okay.
about health in general. And and I kind of like started to more recently I started to like get the like belief that like if you can't manage your health well, then there's not really much you can do else that would like sort of benefit you or that would be good for you.
Yeah. Absolutely. Wonderful. So there is this whole field of study called epigenetics. I don't know if you've heard about it. It's called epigenetics. And what that field of study says is exactly what you are saying. Yes, genetics to some extent will, determine what kind of diseases we might are prone to, but a lot of it is under our control, like,
Yes.
our environment, the lifestyle, the choices we make, the lifestyle we lead, how much exercise we are getting, what kind of food we are eating, are we getting good sleep? A lot of things are under our control. And
Yep.
if we manage to do that, then we can prevent a lot of, diseases. That's exactly what it says. So I think you have given a good information, and I'm very proud of you. Thank you for coming on the channel.
Mhm.
And I hope you will inspire other youth and other teens also to, kind of take care of themselves, make good choices in life, and even more importantly, take care of the environment so that,
Yes.
I definitely hope this cancer can be eradicated for good.
Yes.
I definitely hope that. And it's all in the hands of youth. Young people like
Yes.
you have
Yes.
to, make
Work. Yes.
work for it. Okay. All right. Thank you, Avish. That was
Yes.
wonderful
It
presentation.
was nice
And
meeting
I really hope for you to come back again soon on our channel with another topic if you would like. Okay.
you. All right.
All right. Thank you.
Yep.
Bye. Let me stop the recording.